My name is Kathy Baker, and I'm the co-director of the SGNA Evidence-Based Practice Fellowship and Scholar program. I've had the privilege of working with the SGNA Fellows and Scholars to implement an innovative educational and experiential program to move gastroenterology research and evidence into clinical practice. Working alongside the Evidence-Based Practice Fellows, I help them learn how to identify a focused issue in practice that needs attention. The Fellows learn how to take the evidence in the literature, as well as from other venues like practice guidelines or replicated experience of experts, to plan an evidence-directed project that can be implemented in their practice setting to address the problem that they identified previously. We work through a very deliberate process to help increase the likelihood of success that the Fellows Project will in fact be adopted in their practice setting. For instance, the Fellows identify a mentor in their practice setting that helps them navigate their institutional setting to be sure there is support and a greater likelihood of success. As a group, we come together by phone every quarter to share individual progress, garner support from each other, and share lessons learned. Every year at the annual conference, we meet as a group and continue to share and learn from each other. The Fellows present their projects not only at the National SGNA Educational Conference, but also in their home facility, SGNA Regional Meeting, and other programs across the country. The Fellowship doesn't just ask Fellows to do these things, but gives them training on how to speak in public, develop a poster, and write for publication. The value is that instead of doing this individually, we have a well-developed program for learning and implementing these strategies alongside one another through SGNA. And the relationships endure long past the Evidence-Based Practice Project. The Fellows are working on a variety of topics such as safe handoff in endoscopy, effectiveness of group education compared to individual education on hand hygiene compliance, colonoscopy preparation for the diabetic patient, nurse-administered propofol sedation in endoscopy, the effect of instituting a hospital-wide scope reprocessing committee on standardization of reprocessing, and improving pain management in the hospitalized IBD patient population. This is just a sample of the kind of work that the Fellows are doing. The SGNA Scholars Program allows nurses with advanced skills in critiquing the research literature to come together to develop systematic reviews of gastroenterology research that answer practice questions. The scholars devote their efforts to identifying the state of our knowledge on a given topic. Like the Fellows, the scholars identify a focused practice question and then go to the literature to determine what we know and do not know about a topic. Through the renowned Joanna Briggs Institute, which is an international institute based in Australia, the scholars receive training on the research methodology that allows them to systematically analyze and critique the body of research literature that is available globally on their topic of interest. The scholars learn how to dig deeply into the published literature to find everything that has been published on their topic, and then they systematically work in teams to analyze and synthesize what our current state of knowledge is. Like the Fellows, the scholars also present their findings through presentations and publications of their work. The scholars are conducting systematic reviews of topics such as effective strategies for smoking cessation in people with Crohn's disease, the effect of nurse endoscopists compared to gastroenterologists on fecal intubation for the detection of adenomatous polyps, the effectiveness of BMI for predicting the development of colon cancer in adults aged 40 years or older, effectiveness of simethicone use in capsule endoscopy, the length of time that endoscopes which have undergone reprocessing with high-level disinfection can be safely stored before use, and optimal medical management of hepatic encephalopathy. The work that the Fellows and the scholars are involved in through SGNA is really making an impact on gastroenterology nursing practice. SGNA's vision in support of these programs has established SGNA as an innovative leader in embracing evidence-based practice to support gastroenterology nurses in making care delivery decisions that are credible and based on the best evidence. SGNA doesn't just say, here's what you need to do. SGNA is investing in our members to be a part of analyzing and synthesizing the evidence to drive best practices to the very place where care is being delivered. Not only do our fellows and scholars develop confidence and skill in translating evidence into practice, but they're growing professionally and personally through this journal. If you have a passion for wanting to know the best way to provide nursing care based on credible evidence, then you should consider applying for the opportunity to serve as an SGNA Fellow or Scholar. We are very fortunate as a nursing organization to have the resources and talent to make this vision a reality. Participating in the Fellowship or Scholars Program provides SGNA members the unique opportunity to be part of an innovative program that can transform gastroenterology practice and patient care through translation of best evidence into decision-making and delivery of quality care.